Hello friends, welcome back. If you are new here, I use science to help you cut through fitness myths and make informed choices about your health and well-being. Today, we're back on prenatal. We're going to tackle a really common belief, and this is that postural changes during pregnancy mean your core is weak, your back is unstable, or that your posture needs fixing. Here's the truth. Your posture isn't broken, it's adapting, and those changes are functional, not faulty. So let's start with what actually happens to your posture during pregnancy. As pregnancy progresses, the growing uterus naturally shifts your center of mass forward. To keep your balance and stability, your body makes some biomechanical adjustments. You might see a slight increase in lumbar lordosis or inward curve of the lower back. The pelvis tilts anteriorly or tips forward a little. The thoracic spine may extend slightly to keep your head and eyes level. These changes aren't random. They are intelligent design. A classic 2007 study found that these postural adjustments evolved as a way to maintain balance and distribute weight safely during pregnancy. In other words, this is your body doing its job. Now, a lot of people will interpret those changes as weaknesses, like especially in the core or glutes, but that's not what the science shows. This 1996 study examined how the abdominal and back muscles function during pregnancy. They found altered activation patterns, not decreased activity. So your muscles aren't switching off. They are just reorganizing how they work together to stabilize your changing body. Similarly, this 1995 study showed that pregnant individuals adjust their trunk control strategies to maintain balance. The nervous system adapts movement patterns for stability. That is efficiency, not dysfunction. So when you see an increased curve or a shift in posture, it doesn't mean weakness. It means your body is solving a complex physics problem every day, balancing new mass, new ligament laxity, and new movement demands. You might have heard about relaxin. It's a hormone that increases during pregnancy to help soften ligaments and prepare the pelvis for birth. This often gets blamed for instability, but again, this is context dependent. Relaxin doesn't make you fragile. It creates controlled flexibility in specific joints, mostly in the pelvis, and your muscles adapt to support that extra range of motion. Think of it as the body fine-tuning how stiffness and mobility are distributed to keep you upright and balanced. So exercise, including resistance training, can absolutely help you feel more stronger and more comfortable during pregnancy. It's not about fixing your posture though, it is about supporting your function. A large meta-analysis in the British Journal of Sports Medicine found that regular prenatal exercise reduces pregnancy-related discomforts, improves strength and endurance, and even lowers the risks of complications, all without any increase in injury or adverse outcomes. So when you train during pregnancy, you are enhancing your body's ability to adapt, not trying to reverse natural healthy changes. Your new posture is part of a temporary reversible system designed to keep both you and your baby safe. It is really important to be mindful of how we talk about posture during pregnancy. When we say things like your posture is bad or your back is weak, we are unintentionally reinforcing fear and body distrust. Your posture doesn't define your health, and changes don't automatically mean dysfunction. In fact, most of the discomforts associated with pregnancy posture, like back pain, are multifactorial. They're influenced by things like joint loading, hormonal changes, sleep, stress, and even how much rest you're getting. Pain doesn't necessarily mean something is wrong. It's just information from your body that something needs attention. So the big takeaway, your postural changes during pregnancy are an intelligent temporary adaptation, not a sign of weakness or damage. Your muscles are still strong and active. They are just working differently. Your joints are more mobile. That's to prepare for birth. And your nervous system is constantly recalibrating your balance and coordination. It's an incredibly smart, adaptive process, not something that needs correcting. So rather than trying to fight those changes, you can focus on staying strong, mobile, and confident through movement and self-trust. As always, remember, it's your body, your choice. I'm just here to help you make informed ones.